Vaccinations in pregnancy. Powered by Discover Parenting. Vaccines, not usually advised in pregnancy, live vaccines. This is because there's a potential risk that live vaccines could cause your unborn baby to become infected. But there's no evidence that any live vaccine causes birth defects. Sometimes, a live vaccine may be used during pregnancy if the risk of infection is greater than the risk of the vaccination. Live vaccines include 1. BCG, vaccination against tuberculosis. 2. MMR, measles, mumps and rubella. 3. Oral polio, which forms part of the 6-in-1 vaccine given to infants. 4. Oral typhoid. 5. Yellow fever. Vaccines recommended in pregnancy. Despite of all the facts, there are some vaccinations which are necessary and recommended in pregnancy. These vaccines includes 1. Flu. 2. Whooping cough. 3. Coronavirus, COVID-19 vaccine. Flu vaccine. These changes can raise the risk from flu. Pregnant women are more likely to get flu complications than women who are not pregnant and are more likely to be admitted to hospital. Having the flu vaccine means you're less likely to get flu. Whooping cough. When you have the whooping cough vaccination in pregnancy, your body produces antibodies to protect against whooping cough. These antibodies pass to your baby, giving them some protection until they're able to have their whooping cough vaccination at 8 weeks old. Coronavirus, COVID-19. You're at higher risk of getting seriously ill from COVID-19 if you're pregnant. If you get COVID-19 late in your pregnancy, your baby could also be at risk. It's safe to have the vaccine during any stage of pregnancy, from the first few weeks up to your expected due date. You do not need to delay vaccination until after you have given birth. The COVID-19 vaccines do not contain any live viruses and cannot give you or your baby COVID-19. Travel vaccines in pregnancy. It may not always be possible to avoid areas that require vaccinations when you're pregnant. If this is the case, talk to a midwife or GP who can tell you about the risks and benefits of any vaccinations you might need. If there's a high risk of infection in the area you are traveling to, it's often safer to have a vaccine rather than travel unprotected, as most diseases will be more harmful to your baby than a vaccine. Pregnancy and malaria. Pregnant women are particularly susceptible to malaria. This is a serious condition which, if severe, can be fatal for both a mother and her baby. Malaria mainly affects countries in 1. Africa. 2. South America and Central America. 3. Asia. 4. The Middle East. Protecting yourself against malaria. If you're pregnant, make sure you take precautions against being bitten by insects. For example, 1. Use a mosquito repellent that's specifically recommended for use in pregnancy. 2. Wear a long-sleeved top, full-length trousers, and socks to cover up your skin from dusk until dawn. 3. Always sleep under a mosquito net. Thanks for watching. Like, share and subscribe.